Hello there. Let us continue now. Last time we did until the initial introduction part and few of the aspects of what is the history taking and how are we going with the clinical examination and diagnostic test. Now let us go and dive into what is the role of drug therapy. Overview of the role of drug therapy in dental practice. See here what they say is appropriate dental treatment can minimize or avoid the need for drugs. So if we provide an appropriate dental treatment, we can totally avoid drugs as well. Like treatment of localized odontogenic infection usually avoids the need for antibiotics. What are localized odontogenic infections? You know, right? Periapical periodontitis or pericoronitis, periodontal abscess. These are localized. They are still restricted to that area. They are not spreading. So in those cases, if we can provide an adequate dental treatment, we can totally avoid giving antibiotics. There are so many disadvantages by giving antibiotics. People will develop antibiotic resistance in future when they really need those antibiotics don't work, and they have every drug has a side effect, so there are so many side effects for each drug. Some will be systemically compromised, they cannot take drugs, so all these can be avoided by providing appropriate dental treatment and at an appropriate time. The use of drugs can often be deferred until the response to dental treatment has been reviewed. So we have to actually see how did the dental treatment work. If the dental treatment is working during the time of review, we can totally avoid the use of drugs. Drugs are more likely to be effective as an adjunct after a dental treatment than as a sole therapy. So it is not a substitute for a dental treatment, but they are kind of an adjunct. For suppose if they are having pain, so painkillers will be an adjunct, but they are not the substitute for a therapy. Okay, here let us highlight this point. Drugs are more like to be effective as an adjunct of the dental treatment than as a sole therapy. I'm sorry for that. Let us go back and highlight one more time. Yeah. Oops. Yeah. Drug choice is based on efficacy. How do we choose drugs? We choose the drug based on the efficacy, safety, and suitability. What is suitability means whether the drug is suiting for the patients, whether he has taking into account the factors such as adherence issues, whether the patient can remember and take the medicine, patient comorbidities, what are the other systemic conditions or diseases the patient is having, which might affect the efficacy of the drug, or the availability of specific formulations and cost. When we are everything should be taken into consideration, whether the drug is effective for that disease or not. See, for anaerobic infections, we can't give normal antibiotics. We have to give antibiotics which act on anaerobic bacteria like metronidazole. So we have to see the type of infection there, and we have to give the antibiotics. Antifungals for fungal infection. If you give antibacterials for the fungal treatment, it won't work, right? So we have to see that the drugs are effective and they are safe and they are suitable for the patient, and also the cost is in par with the patient's affordability, right? So we have to see all these things. In this para, the bottom line is we have to use drugs only as an adjunct but not as a replacement for the treatment. Dental treatment is always necessary or important in a dental condition. We all know that, but sometimes we tend to give patients some medication, prescribe some antibiotics, and patient will say, "Come on, doctor, prescribe me some antibiotics. I'll go and come again later. Give me some medicines." Once we write the prescription, they won't come back because the effect will reduce, the infection will might reduce for some patients, so they won't turn up back, and eventually what will happen, either the infection might return back, recur again, or spread of infection can occur, or it can be life threatening as well. So as a dentist, we have to be very, very careful when prescribing the medications for the patient. Inappropriate prescribing can lead to ineffective or unsafe treatment, right? Ineffective, it could be ineffective or unsafe as well. Exacerbate or prolong illness. It can either increase the disease or prolong the illness, distress or harm the patient, and can be costly. Antimicrobial use contributes to antimicrobial resistance in the wider community. Antibiotic resistance actually spreads among the people in the community. Like how it can spread in the family only, it can spread. For suppose if we give an antibiotic and the patient, everybody can have resistant bugs inside our body which are very resistant to the antibiotics. So what does antibiotics do? The antibiotics kill the bacteria which are susceptible to the disease, susceptible to the antibiotic, right? So there will be some bugs, and these bugs might be susceptible to the antibiotic we give, so they will be killed. But also there will be some bugs inside our body which are resistant to the antimicrobials. What will happen when the non-resistant microbials get killed? The resistant microbials increase in number, they will multiply in number, so they will multiply inside me, those resistant bacteria. And when I touch somebody, or when it can spread, these bugs can spread right within the family also. So the antibiotic resistance kind of spreads in a wider community, from our children to their friends to their parents. It is a huge, what a domino reaction, domino effect. Everybody, it will spread to everyone. In Australia, medication related problems have a high annual incidence of hospital admissions and emergency department presentations. Because this is an Australian based book, they are giving the statistics of the Australia, but in general, if we count in even in India or in any other country as well, medication related problems are patients who are taking medications and the side effects of those medications. There will be more annual incidence of hospital admissions and emergency department presentations. Many adverse medication events can be prevented by taking a detailed history and prescribing rationally. These words, they might seem very minute or trivial, but it is very important. When we are taking history from the patient, it is very, very important to ask the history of the drug allergies or any side effects it happened. So we have to be very careful when questioning the patient and asking history. Okay, patients may attend a dental appointment with an expectation of a particular treatment, right? They usually, patient will come, as I just said earlier, they can come and expect a particular treatment, like give me painkillers, give me antibiotics, possibly influenced by advertising, unrealistic expectations, or drug dependence. That could be anything. When the patient comes and asks us for certain prescribing certain medications, that could be influenced by the advertising. In the TV, they might see a commercial, okay, if you have cough and cold, take antibiotics, or when you have an infection, fever, take this, take that painkiller. So they see advertisements, they can come by that, or they can see our billboards or advertisements which we only put outside on the road for the patients. They can see that and come asking for prescription, or unrealistic expectation. This is in general, they're talking about the in general expectations of the patients, like when they come for the veneer, even though they won't even realize how crooked their teeth are, or how difficult it is for us to bring that to the normal alignment, but they come showing the photographs of Hollywood celebrities or Bollywood celebrities, telling that, okay doctor, I need this kind of smile, I want this kind of Hollywood smile, provide me with that. We can't just give in to the patients. We can't set unrealistic expectations to the patient. In fact, we should not even treat the patients until they simmer down their expectations, because they will come back at us only. Once they won't like the results, because they will never be satisfied with whatever we do. They'll have some or other problem with whatever we do. So they end up coming back to us again and again, or bad mouthing us everywhere. So we have to be very careful when treating those kind of patients who are having unrealistic expectations or drug dependence. Some people will just have painkillers. They might ask for high power painkillers because they have chronic pain. And when we prescribe oxycodone or something, those kind of drugs, they have drug dependence for those drugs, opioids. So we have to be very careful. Always consider alternatives to drug treatment and involve the patient in treatment decisions. We should always discuss with the patients about the alternatives, what we can do, even though they might force us, they might, pressurize us to give certain medications, but we have to explain to them. Patients are more likely to choose conservative treatment strategies when a shared decision making approach is adopted. So when we clearly explain to the patient, it has been observed that patient will choose the conservative treatment strategies. Consider the balance of benefits and harm for a drug therapy. Whenever you're prescribing a drug, this will keep coming time and again in this document, telling that we should always weigh the harm and benefit balance. Right? If the drug therapy is appropriate, choose an evidence based treatment with consideration of individual patient factors. If we feel that drug therapy is necessary, then we have to weigh the individual patient factors again. Again, we have to see what is there in this patient. Is he having any condition? Is he having any allergies? Is he having pre-existing cardiologic conditions or anything which can influence the drug reaction? We'll discuss about all those things in the next documents, but we have to ask the patient, or we have to consider the individual patient factors. Consider principles such as antimicrobial stewardship. Stewardship means nothing but it's like we have to act like a warden who is disciplining the students. We have to be very careful. Rational prescribing of antibiotics is called as antimicrobial stewardship. And rational choice of analgesics, even the painkillers also. The NSAIDs we routinely take or give to the patient, they have cardiovascular effects, renal effects, and gastrointestinal effects. They have on respiratory rate, they have effect, and they can cause bleeding. So we have to choose carefully and rationally. Evaluate drug information to determine the therapeutic value, how valuable it is. New or expensive drugs should be critically evaluated in comparison to established treatments. Whenever a new drug comes into the market, the marketing people will come, this they'll come and tell us, they'll explain us everything, and they'll give a sample to us also. But when we are prescribing to the patient, we have to really be careful when prescribing the new drugs. We have to evaluate what is the chemical composition of this, what is the chemical composition of that, how effective is this, and how is the cost, whether any advantage is there when the patient buys it at a higher cost. Is there really a visible advantage for the patient? So we have to take all these factors into consideration. Just because some representative came and gave us the samples and asked us to prescribe the drugs, we can't prescribe. We have to really see whether it is really effective, whether the drug is worth it for the patient. For advice on prescription writing, we'll discuss that also. Provide the patient with recommended information and advice about the prescription, including discussion about any off label prescribing. We have to discuss everything to the patient. Don't hide anything from the patient. Be clear from the day one. Be clear in telling what is the drug you are giving, what effect will it have. Everything we have to be very careful. Now let's see what is off-label prescribing in dental practice. Off-label use refers to use of a medicine in a manner that is not approved by Therapeutic Goods Administration. Even in India, we have the uh, uh, approval of the agency. We need approval of the authoritative authority. Without that, some drugs can be sold in the market. So these off-label use refers to use of a medicine in a manner that is not approved by the Therapeutic Goods Administration. Examples are use of a different dose or route of administration, or use for an unapproved indication or patient group. The manufacturer of the medicine does not carry any legal responsibility for off-label prescribing should an issue arise. If we prescribe some drug off-label and something happens to the patient, the manufacturer of the medicine does not carry any legal responsibility, because they already made themselves clear that their drug is not approved by the authorities. Therapeutic Good Administration did not approve their thing. So that means we are legally responsible for the off-label prescribing if any issue arises, such as serious adverse reaction. Legal liability lies solely with the prescriber. That means it is with us. Appropriate off-label prescribing requires evidence of efficacy and safety and consideration of balance of benefits and harms. Again, time and again, as I've told, it keeps on coming, like we have to give consideration for the balance of benefits and harms, and evaluate all intended off-label use against the guiding principles summarized in the article in Australian Prescribers. So this is another document, that is a different document totally, but we have to evaluate all the intended off-label use against the guiding principles. Off-label prescribing should be discussed with the patient as a part of obtaining their informed consent. When we are getting consent, we should also tell, I am prescribing you a drug that which is off-label. It may incur additional cost to the patient. Okay, again, they have highlighted this point. Inform a patient if their prescription is for off-label use and explain the implications. Next, use of compounded medicines in dental practice. What are compounded medicines? Some medicines will not be directly available in the suitable form. Method of administration differs, right? Like a solution, it may be like a cream, gel, or a lotion, or a tablet, or a suspension. So different forms. So compounded medicines are medicines made by pharmacists. They make it from raw ingredients for an individual patient. When a right combination is not available in the market, the pharmacist can compound the medicines. Compounded medicine should only be prescribed when no suitable medicine registered by the Australian Therapeutic Guide Administration is available. So we have to carefully see with whether if we don't have the drug available in the market, then only compounded medicine should be made. Patient should be told why a compounded medicine is being recommended and how it differs from a commercially available medicines. Right? Each medicine, each drug, what we take is prescribed by certain raw components, right? Compounded administration means the pharmacist himself makes the drug compound for the patient. Like, homeopathy medicines, Ayurvedic medicines, wherein they'll compound the medicines. So, compounded medicines do not undergo the same quality assurance assessments as to establish safety and efficacy that are undertaken by the TGA registered products. The products which are registered, they have the quality assurance assessments like safety and efficacy. But these compounded medicines, they won't have that, but their preparation is subject to legislation. Guidelines for pharmacists on compounding are published by the Pharmacy Board of Australia. Again, they have separate guidelines, of course, but still, there is no quality assurance assessments for these kind of drugs. Dentists can prescribe compounded medicine for individual patients but cannot prescribe batches of medicines to be used as stock for multiple patients in a practice. We can prescribe a compounded medicine, but we cannot prescribe batches of medicines. We can't make one compound, we can't ask the pharmacist to make one compounded medicine and we can't sell to the multiple patients in a practice. Prescriptions for compounded medicine must detail the active ingredients, their strength, and the formulation required, as well as the other details listed. We'll read about that. A dentist can prepare a small amount of medicine. That is, we can prepare a small amount of medicine, that is, crushing a tablet into water to create a mouth rinse for use during dental appointment. Only during dental appointment. But it is outside a dentist training and a scope of practice to compound a medicine for a patient to use at home. We can't make a compound medicine, we can only prescribe, and a pharmacist only can make. We can just crush a small chlorhexidine tablets or whatever it is for mouth rinsing, essential oil mouth rinse. We can make those kind of small things, but we can't make a compound medicine to the patient. Overprescribing and underprescribing. What is overprescribing and what is underprescribing? It is important that the dose, duration of treatment, and quantity of drugs prescribed are appropriate for the patient's condition. Right? We have to give in such a way that whatever disease the patient is having, we have to choose the drug accordingly. Overprescribing is wasteful. We can't give the medicines for longer time. If we give antibiotics for longer time, they end up developing resistance. So overprescribing is wasteful and increases the risk of adverse effects and overdose. Ultimately, the drugs are chemicals. When we give certain amount of chemicals into the body, they obviously will have the side effects and overdose effects. Of particular concerns are the drugs that cause dependence or prone to be non-medical use, like opioids and benzodiazepines. If we give those kind of medicines, patients will end up getting addicted to those drugs. They become dependent on those drugs. And drugs whose therapeutic dose is very close to toxic dose. Right? Therapeutic dose means the dose which is effective for the patient, for the 50% of the population to reduce the condition. When the therapeutic dose is very close to the toxic dose, that means if the toxic dose, for suppose if the therapeutic dose is uh, you say 50 milligrams, 50 milligrams, you can say, yeah, 50 milligrams, then if the toxic dose is 55, it is very close to the toxic dose. The therapeutic dose, the dose at which the drug is effective is very close to the toxic dose, then those drugs are very risky. If the patient end up taking a little bit more unnecessary medication, then they'll have the toxic effects. So overprescribing of antimicrobials can promote antimicrobial resistance. So overprescribing is also not good. It is wasteful. And underprescribing is also wasteful and potentially harmful because it can result in ineffective treatment. If you underprescribe, if you only prescribe, ask the patient to take antibiotic for 2 days, and when the pain subsides, the patient stops taking antibiotics because they are not good for their health. It results in ineffective treatment because the infection is not completely gone from the body. So non-medical use is the use that doesn't align with the directed use. Here where they gave non-medical use, right? Or prone to non-medical use. They use it randomly. When there is no need also, they use it. Example, use for a symptom other than the clinician intended used to become intoxicated. Some patients will have the habit of taking painkillers continuously, right? Even though there is no reason for it, and they become intoxicated, dependent on it. Like drug people who take drugs, right? Like that. And then sporting authorities and the use of drugs in dental practice. Sporting authorities prohibit the use of some drugs by people competing in sporting events. They have like steroids, they should not take steroids, these kind of things they should keep in mind. Some of the drugs prohibited in sport may be prescribed or administered by dentists. So those people should clearly tell us. Most elite athletes are aware of their requirements for their particular sport. Or otherwise, we have again sport integrity Australia, or they'll have different agencies. Every country has different agencies for that. And next is referral. So this is again very important. Another thing, we should know when to defer the treatment and when to refer the treatment and when we should take up the patient. The treating dental practitioner should consider referral when the patient's condition and treatment is beyond their scope of practice. Like they are not used to treat that kind of cases. When the case comes, when the patient comes for suppose with a irreversible pulpitis or necrosis of sevens or eights, right? Erupted sevens or erupted eights, and you are not aware, you don't know how to do, you only did until anteriors in your internship or anywhere, you are only used to treat the endodontic, I mean, do the root canal treatment for only anteriors or maximum premolars. You don't know how to do molars, then you can't touch the patient unless you are aware of it, unless you take a course and you are very well versed with the procedures. So when it is beyond your scope of practice, please don't do the case for the sake of money, because you will end up in trouble. So we should really know, we should be able to assess the difficulty of the case, whether we are the right person to do or not. For the sake of some amount of money, if you do these kind of patients and if they end up having some trouble, you will be at trouble. They will sue you. You can go to jail also. So you have to be very careful when you're doing a treatment for the patient, unless you already did once or you took a course and you are confident in doing that. Please don't do that. Eh, or when the patient could benefit from expertise or specific services not available at their clinic. When a better alternate treatment alternative is present for the patient and some other doctor is doing, we should always think about the good for the patient. Do good, do no harm. The basic ethical principle is do good, do no harm. Right? Let me write it here for you. Right? You should always remember the ethical principle. One of the ethical principle is do good, do no harm. And a referral form for a dental practice should be in writing. We should refer the patient to another practitioner. It should be in writing. Outline the presenting oral or dental complaint. You should write in that form why the patient came to you in the first instance, what is his complaint, what did you diagnose, what is your provisional diagnosis if you know. If you don't know or if you can't find out what is the reason, what is the disease, then you tell you don't know the diagnosis, you are not able to diagnose, and you have to ask the help of a specialist for diagnosis. And relevant patient details, what are all the details necessary for that particular condition, you should give everything to the specialist and be recorded in the patient's history. That referral form copy should be taken and put in the patient file. This is again legal thing. You need that in the patient file. Everything you do or say to the patient should be in their file. You have to document it. If a dental practitioner receives a referral, if we receive a referral, they should provide a written clinical summary of the consultation. For suppose somebody referred some patient to us. Then once we treat the patient, we should write the summary of the consultation and treatment plan to the referring practitioner. We should, the doctor who sent us, we have to write them back that this is all we you have found, what did you do, what is the summary, and what is the treatment plan to the referring practitioner. To the other doctor, we have to write a letter. And clinical records should be kept in accordance with the, again, every country has guidelines. You have to see that and practice and keep the clinical records in par according to the guidelines. Infection control. This is another book. We can discuss that as well. But infection control is really, really important. You can't even imagine what kind of diseases or how much we are spreading to the patients. Just a simple, I will tell you a simple thing. If our hands are soiled, if we touch something dirty, at least a dust, right? If you touch something dirty and if you don't wash that hand, you are end up spreading the dirt in your hand or the bugs in your hand for the subsequent 19 touches. Like means after you touch one dirty area or mold or some kind of infection, if you don't wash your hand and keep touching other areas, you end up touching until 19 subsequent touches, you keep on infecting. That is why in COVID also we said that you need to wash your hands. You whenever you touch something or whenever hand railing, you touch outside things. We don't know what people touched in that area. So it is very important to do hand hygiene. This is a small example I am giving you. We can read that book as well, but it is very, very important to follow the infection control in the practice to prevent the transmission of infectious diseases. Again, standard precautions, transmission based precautions, pre procedural rinsing, so many things are there. We'll discuss that as well. That is also important for your practice. Okay. So guidance includes advice on standard precautions. Standard precautions means which we follow routinely every day for every patient, and precautions for the patients with known or suspected infectious diseases like COVID, TB. This kind of patients, if they come, avian flu, influenza, we need to perform transmission based precautions, including pre-procedural rinsing. You should ask the patient to do the pre-procedural rinsing as well. Okay. Next topic is dental treatment during pregnancy and breastfeeding. Most dental treatments can be carried out safely during pregnancy. There is no need to avoid treating the patients during pregnancies when it is emergency or infection is there. We can carry it out safely, right, during pregnancy. Emergency medicine care should not be delayed during pregnancy. If the patient is having an abscess or a spreading infection, you can't delay because the infection in the body can also have adverse pregnancy outcomes. So, in general, elective treatment means which is not an emergency. That is by choice, like keeping veneers or Hollywood smile, aesthetical treatments, which can be delayed. They should be best performed in the second trimester. That is fourth, fifth, and sixth months of pregnancy. Treatment is avoided if possible or undertaken with additional consideration. Only we have to avoid the elective treatments if possible, or we can undertake only with the additional considerations in the first trimester, because we usually avoid in first trimester because patients are more likely to feel unwell and have strong gag reflex. So why we are preferring elective dental treatment only during the second trimester and not in the first and third trimester? These are the reasons. In the first trimester, patients are more likely to feel unwell. Some people will have continuous nausea, vomiting, and they have severe gag reflex. And in the third trimester, from the mid trimester onwards, because of the risk of supine hypotension, as their belly grows bigger and bigger, it ends up putting pressure on the superior vena cava or inferior vena cava, right? In the supine position. They put pressure on the inferior vena cava. If a procedure is required, precautions such as positioning the patient in the chair so that they are tilted to their left can reduce the risk of hypotension. So when the big belly is growing, when the baby is growing, it will put pressure on the veins and the patients end up having supine hypotension. Their BP tend to reduce in the lying down position. So we have to be careful. That is why we usually avoid elective treatments in the third trimester. But if there is an emergency in any trimester, we should do. Like abscess is there, periodontal infection, severe bleeding gums or anug, any kind of thing which is an emergency, we should treat it. That is not avoided. Only the elective treatment is not recommended. Okay. Elective procedures requiring general anesthesia or IV sedation should be deferred until after birth and preferably until after breastfeeding has stopped. If the patient is unsure whether they are pregnant, if the patient is of an age around which they could get pregnant or they are newly married, you should ask. That is what is important in history taking. We should ask them, are you expecting anything? Are you expecting to be pregnant? We should ask those questions. Defer elective treatment decisions until pregnancy status is known. After asking history only, we'll get to know that, right? Whether they are pregnant or whether they are expecting to become pregnant. And then we have to ask them to be sure to get the pregnancy test done. Then only we can do the treatment. Otherwise, if it is an elective treatment, defer it until they are confirming that they are not pregnant. If intraoral radiographs are necessary for assessments or diagnosis of infection or trauma, concern about radiation exposure is not a reason to defer them. If you really need for the diagnosis, if the patient subjected to trauma, tooth broke, you need an X-ray, then you don't have to think about the exposure, overexposure and all those because you need it for the diagnosis. As low as reasonably possible, it is always there. State that intraoral radiographs are not contraindicated during pregnancy. However, a leaded drape is recommended when the X-ray beam is directed towards the patient trunk. Right? When we are directing the patient X-ray tube, if for suppose we are taking a maxillary occlusal radiograph and the tube is directed towards the trunk of the patient, then we need to drape the patient. Otherwise, even drape is not needed when the X-ray beam is directed towards a patient drug when taking the occlusal views of maxilla. Before prescribing a drug for a patient who is pregnant or breastfeeding, consider the general principles of drug use in pregnancy and breastfeeding. Every topic we'll discuss in the further chapters as well as the safety of individual drug. Advice on prescribing in pregnancy is available from the drug information sources, including medicine information services. So we should carefully assess the medical information of the particular drug before prescribing to the patient. Local anesthetics can be used for dental procedure in patients who are breastfeeding without the need to disrupt their usual schedule because distribution into breast milk is very minimal. Local anesthetics, the distribution into breast milk is very minimal, so you can use in the patients who are breastfeeding. For advice on pregnancy associated oral health and conditions and management, we have another document that is for that. We can call the patients can call 1300 medicine. This is all for the Australia. No need to think about it. But yeah, this is the chapter what is of principles of diagnosis and management in dental practice. Right, we should keep all these things in mind when we are doing, right? We have to know the principles, what are the basic principles of the diagnosis and management, like establishing the diagnosis, treating the acute condition, addressing the cause, addressing the effect, restoring the normal function, monitoring healing and regular monitoring and healing. What should we do in the history taking, open ended questions and clinical examination, right? Diagnostic test when needed. When are drugs used? How can we use off-label drugs? Sporting in people who are playing sports, what are the requirements? Over prescribing, under prescribing, pregnancy, right? Referral. So this is an overall view of what are all the things that could happen in the dentistry, right? Now, next chapter, dental prescriptions and prescription writing. This is for the next day. Okay. Let us discuss later on in the next day. Hope you really enjoyed this. Thank you so much for attending the session or listening to my session. If you like it, please share or comment on these videos so that I can do more and more. I can explain, we can discuss many things. I can go live as well. If you comment, I will reply to that. Right? Please take some time. and listen to this. It will be really helpful for your clinical practice. Thank you.